May is a very special month when it comes to eye care. Dr. Pavan Avinashi is back. What is May?
May is Vision Health Month.
Vision Health Month. All kinds of tips for kids, teens, adults, and seniors on how to take care of our eyes. And let's start with kids. Some of the common things you see when patients are coming in of how do we keep these eyes healthy? Yeah,
the campaign itself, it's charged with the importance to educate the public about vision health and the process of elimination or reducing preventable vision loss. And with kids, we start off by telling parents that it's just about bringing them in. Even till today in the Canadian school system, 1 in 4 kids actually have a undiagnosed visual condition. And with 80% of what they register or visually process comes in through their eyes, it's important to get their eyes checked regularly. So we tell parents to bring their kids in by the age of 3 to 6 months for the first screening, and then every year after 3 years of age thereafter.
I always remember growing up and the parents saying, you need to sit this far away from the screen, from
Correct.
the TV. What is the rule of thumb when it comes to this?
Well, there's no exact inch or measurement. I think it comes down to certain visual ergonomics and hygiene. I mean, with the amount of usage of electronic devices that are, I mean, everybody does, but especially our kids do at this age, talking to them about proper protection, even blue block protection, or taking breaks every 20 minutes, or proper distances, or proper angles. That's what we want to do in our office, that we do with our practice with our kids and our teens about the education about proper usage of visual devices.
So any healthy distance that you would recommend overall?
You know, ensuring that it's not within a 16 to 18 inch range for reading things or tablets. For computer screens, you want to go a little further than that, even up to 24, 26 inches.
Okay, you mentioned protection as well, and that's interesting. If the sun is not out, it's a cloudy day, do we still need to protect our eyes when we're outside?
There's still UV coming in through the clouds and affecting our eyes. So that's one of the top health tips we talk about is UV protection, and that starts from childhood. They say 50% of the sun damage we'll do to our eyes and to our skin happens in the first 15, 20 years of our life. So starting at the young age of even 3 years old or 3 months or 6 months old to get them into sunglasses is important. Screen
time, obviously a hot topic, not just for teens, for adults as well.
Absolutely.
How much screen time per day, and the 20-for-20 rule, tell us about that.
Yeah, we advocate a rule called 20-20-20. For every 20 minutes of screen time that you do, take 20 seconds to look away, blink, relax your eyes, and actually just look at something 20 feet away. So every 20 minutes, take 20 seconds to look at something 20 feet away. So it's called the 20-20 rule.
An amount of screen time per day, what do you recommend?
Well, I think that's hard to advocate, but for kids under the age of 2, we say no screen time. And then anything above the age of 2, limiting it to maximum 20-minute segments at the most up to 2 hours in a day, but that's still pretty excessive.
Okay, we love show and tell here on Breakfast Television. You brought a prop for preventative health care for seniors and some of the conditions they're dealing with. What do you recommend?
That's right. Well, in Canada, and this is a pretty alarming stat, that 1 in 7 Canadians will develop a sight-threatening condition in their lifetime. So that being said, some of the top names that we hear in sight, or we talk about, is macular degeneration, glaucoma, diabetic retinopathy, and cataracts, which is one of the most preventable ones. So if 75% of that is preventable, just through education and regular eye exam, that's why we want to try and reduce that and that sight loss probability. And with the human eye, we look at everything from the front to the back on a regular eye exams. Cataracts typically affects the lens, which is in the front of the eye. That UV protection helps lower cataract development. In the back of the eye, where the macula is, this is where your central vision is focused. This is the leading cause of blindness is macular degeneration. Eating a well-balanced diet, UV protection, things like that is very important. And then glaucoma typically affects the optic nerve in the back of the eye. And that's an asymptomatic disease. It's one of the top causes of blindness as well. And coming in for routine eye exams, including getting your pressure checked, is the best way to prevent glaucoma or avoid glaucoma at a late stage.
And adults every 2 years for that regular eye exam?
It depends, 1 to 2 years. A healthy eye would say every 2 years, but otherwise we advocate check yearly, see clearly.
Oh, nice tagline on the end of it. Yeah, you've done this before.
I can't take credit for that.
Online resources for more information for people that want to get informed?
Yeah, the CNIB has some great resources. I'd say just checking in with your local optometrist on an annual basis, I think is very important. They'll give you a tremendous amount of information and ensure your eyes are nice and healthy to see the world.
Good deal. It's a good month. It's a good